Although we did have some declining cases, we're now starting to see increasing cases here in Florida. And I think we're seeing more people getting infected who may not necessarily be that sick that they need to go to the hospital. But if they're infected, they can still transmit the virus even when they're not having much in the way of symptoms. So we should still continue to be careful and use face masks when we're outside and continue the social distancing, the hand washing, and wiping off common surfaces. The concern is that somebody who's infected may not have symptoms, but if they're around somebody who's at risk to get really sick, they could still transmit the disease. So we can't put our guard down. We still have to be vigilant. We still have to be smart and cautious and use proper protection. Well, we've learned a lot along the way. We're getting better, I think, at handling it. We're learning what to identify as risk factors for people who are going to get into trouble. We do have the remdesivir, which is an IV drug that was approved to treat COVID. And in the sick patients, we've been able to get that through the Gilead donating the drugs to the government, and then the state departments of health have been able to get it to hospitals that need it for their patients. We've used a lot of the convalescent plasma. We think that's really making a difference. That's patients who have had COVID donate their blood once they recovered, and then the blood banks process the blood, take out the antibodies to give to patients who are still in the hospital very sick with COVID. So that we think really has helped, and we're part of a large nationwide study the Mayo Clinic is sponsoring looking at plasma from recovered patients to give to patients with active disease. We also, we're learning that steroids seem to help. That study just came out. And we're just getting better at managing, looking for things that mark a concern of worsening status and just supporting them through it. Vitamin C, zinc, all the things we do to the patients that end up in the intensive care requiring increasing support for their breathing. Well, this is a different virus than the flu virus. So the flu viruses, especially the type A flu viruses, change every year, and they're a type of viruses that assort their outer proteins regularly, so the vaccines that we make one year don't work usually for the next year. This is a different virus. Although it does mutate some, it's not to the degree that we see with flu. So one vaccine, when made available, should work. And there's an incredible amount of effort going on now to develop these vaccines. Several are already far along in clinical trials. The hope is that maybe by early next year we will have some vaccines available. So I think that will be the answer ultimately. The way it usually works with a virus, once it goes through a population that's never been exposed, it eventually hopefully will burn itself out and we'll see the virus disappear. Whether it comes back or not is still unclear. Most people think it will, though some people think that since it is similar to the SARS-1 virus that occurred years ago in China, it went away and never came back, then maybe this one will go away and not come back. We just don't know. That's why we have to be prepared. We have to continue following safe infection control practices, wearing face masks in public, washing our hands, keeping the social distancing, and people who are high risk to get really sick, those over 65, the elderly, those with chronic medical problems, should really be careful and pretty much still self-isolate at home. As a virus goes through a population, generally viruses get weaker as they progress through a population that has never had the virus before. The more times it replicates and goes through different people, the less virulent it becomes. And I do think we're noticing in New York, they've described that the patients coming with COVID now are not as sick. And we've been seeing that too. Though I'm a little bit concerned because just recently we had a couple admissions where the patients that came in are pretty sick. But in time, the virus does get less virulent. It gets weaker the longer it keeps going and replicating through different hosts. And once it runs out of hosts, it eventually burns out. Once most people have had the virus or the population has developed a significant amount of what we call herd immunity, the virus pretty much burns out. It has nowhere else to go. It needs people to survive. It doesn't survive outside the human body. I think we're making progress. I'm optimistic, like I said at the beginning, that we are going to eventually have good vaccines, that we are going to get better drugs. There are a lot of research underway. We're learning a lot along the way how to better manage patients, but the key message still is to be smart, be careful, be aware that the person sitting next to you or talking to you in the lunchroom could possibly have gotten the virus and not have symptoms and could potentially be transmitting it. That's why it's so important to wear face masks, not to protect you from the other, not to protect you from the other people, but from you not transmitting the virus. So the mask doesn't really protect you from getting things in, but if everybody's wearing a mask, then nobody's transmitting the virus, and that's how it helps protect everybody. So everybody's keeping their own secretion, so to speak, contained, so that you don't have the opportunity for the droplets to hit another person who might then be vulnerable and get sick. So the important thing about face masks is they have to be worn over the nose and mouth. I was at the airport the other day and I see people wearing them in various stages, dangling from the ear, under the chin, on top of the head. Unless you wear the face mask to cover your nose and mouth, you're not really doing anybody any good. And so it's important for people to remember that when you're around somebody, you're closer than that 6 feet, make sure that they're wearing their face masks properly and that you're wearing your face mask properly. And that's something we're trying to emphasize here in the hospital, especially when we're sitting in close quarters with friends or our little lunch break groups, whatever. You have to remember you should still wear the mask when you're not eating, because you just don't know when somebody might just be coming down with the virus and not even know it, and that's when they're more likely to transmit it. When they have symptoms, people know to stay home now, we hope, and they self-isolate. But right before you get symptoms, or some people have the virus and don't even have symptoms, they can still potentially transmit it. So you have to really be careful, continue to use common sense infection control guidelines that we've talked about, and I think we're going to get through this, especially as our treatments get better and ultimately when the vaccine comes out.